The United States has a long history of migrant workers moving from location to location in pursuit of employment. Principally among them are migrant and seasonal farm workers. Thousands of men, women, adolescents, and children leave their homes to work in low-wage jobs.
I was a former migrant farm worker. I started migrating when I was about 12 years old. The first state I migrated to was here in California.
Migrants are laborers who leave their homes and travel.
But then I got married and moved on to Montana with my husband. Had my first child over there all by myself. No support whatsoever. I wish I had had a promotora program then.
The most important thing is work.
I remember being so fearful of having a baby, crying, and me not having a phone, a car, anywhere to go with, because my husband worked 10 or 12 hours a day, and he was gone all day. So I was all there, all by myself in the farmhouse. They provided housing. It was a little house, and then it was just one family. For miles and miles, I couldn't see people because it was far from town.
For many migrants, the kind of work they must do includes unique hazards that can result in illness or injury. Because of the need to continue to earn money, illness or injury will often only receive attention when it interrupts work.
The emphasis is on work. They are working so hard that taking time and putting themselves first before perhaps their families and making money, which is why they're in our area, is always a challenge for them personally to be able to make that decision to leave a job and come into a health center to seek out health care.
Consider a career in migrant health. Migrant health centers fill an important niche in the national healthcare system. One effort to meet the needs of this vital workforce has been the institutionalization of healthcare designed to meet the specific needs of migrants. Federally funded migrant health centers are located across the country, many in isolated rural communities, providing the only link between migrant workers and a mechanism to keep them healthy.
Our healthcare team is composed of physicians, is composed of nurses, nurse practitioners, other kinds of healthcare disciplines, such as we have mental health providers, we have drug and alcohol counselors, and we have a host of other people that are really a part of the holistic approach to delivering healthcare.
The clinician as a leader of the team is someone we look for.
The other thing besides the patients is the other people you work with. There is over and over and over and over again just a fantastic, interesting, full of life group of people who work in migrant health, and they come from all over the world and they have all sorts of backgrounds, and it's just a really fun thing to get to work alongside them.
Many migrants work outside of the wide net cast by the Migrant Health Program, and more is being done to take healthcare to them. New health centers or new sites for existing health centers are opening each year. Healthcare providers with the skills and compassion needed to care for this marginalized group are needed. Maybe you are the kind of clinician we are looking for. Why did you?
To help people who need help, to have relationships with people.
The reason I got into medicine in the first place clearly had something to do with my interest in social justice.
We all have a really strong desire to work back, especially in migrant health, and try to give back to the community that really helped us so much.
I got into it as an altruistic type of thing, and then it grew into different forms of reward for me working with them.
I wanted to work somewhere where I felt like I was going to be needed.
Why did you select a career in healthcare?
People who enter medical school are fairly idealistic because there's a lot quicker ways to make money than go to medical school. You can do things that take a couple years instead of 7, 8, 12 years to be good at. So for many people, I think it's an opportunity to practice medicine the way they dreamt about practicing medicine.
Even before I finished school, I knew I wanted to work in a community health center that, with a population primarily of migrant farm workers.
The reason that I find this a gratifying experience, the reason that I keep going back, is because I feel that in some way I'm making some small contribution to the welfare of this population.
Whatever your reason, as a healthcare provider, you are in a position to make a difference in many people's lives. Like many others, maybe you want to make a difference in the lives of migrant and seasonal farm workers.
And this population in our country, in the United States, represents for me one of the populations that is in most need of people who are interested in issues related to social justice.
And what will you get out of it?
It was exciting, it was academically challenging, and it was emotionally rewarding.
Consider a career in migrant health. You could do a world of good.
Community health centers today are as competitive with salaries and benefits as any other private practice. And as a matter of fact, it's probably the ideal place to practice simply because it offers all of the benefits of a private practice and very few of the problems and inconveniences of running your own private practice.
The ways that students can, even before they are into a graduate program, they can work on research projects, they can do community service, they can volunteer in clinics, help with health education, do outreach, but become familiar with the population and indicate in some continued effort over time that they have a real commitment and interest in this population.
I'm very impressed when somebody comes in the door and they've taken the time out of their lives to volunteer or to be employed in a summer job that exposes them to real life experiences that farm workers are living and health centers are dealing with.
A lot of individuals get to like what we do and really sort of fall in love with it while they are students.
Do you want to be a member of an exceptional team providing top-notch health care to third-world populations outside of the usual healthcare environment?
There are certain characteristics that are critical and necessary in order for us to hire them. The first thing is they have to understand the mission of the organization. They need to have some sense about what that is and what this is going to mean in their practice. The second one is if it's one of our rural clinics, they need to understand that cappuccinos at 3 o'clock in the morning are just not going to be available to them, but that there are other benefits to working in small communities. The other thing that we look for is, as I said a little earlier, the understanding that they work in a team, that they do not solely control the health care of that patient. They make all of the decisions, they give us the foundation for the care that needs to be provided, but they are not to do it all. We have a team of people that work around them. So they need to understand that, unlike in a private practice, they control it all. As people come out of medical schools or residency programs, money really is a problem, and we can't ignore that. So we have, along with the National Health Service Corps, loan repayment possibilities.
We're willing to invest in a person who is willing to invest in us and in the population.
It was very fulfilling. It was exciting. It was academically challenging, and it was emotionally rewarding. And every day I could go home and look at myself in the mirror and know that I've done a good day's work and that I did a little bit to change the world.
For more details on pursuing a career in migrant health, visit the Migrant Clinicians Network website.